Hello and welcome to Medical Minds, your trusted source for health and wellness. In today's video, we will explore hepatitis. We will discuss the various forms of hepatitis, their signs and symptoms, available treatments, and ways to avoid contracting the illness. Now let's begin. Hepatitis is an inflammation of the liver commonly caused by viral infections and other factors such as alcohol consumption, toxins, certain medications, and autoimmune diseases. The liver is the vital organ responsible for filtering toxins from blood, aiding in digestion and storing energy. When liver becomes inflamed, it can lead to severe health complications. An estimated 354 million people worldwide live with hepatitis B or C, and for most of them, testing and treatment remain beyond reach. Some types of hepatitis are preventable through vaccination. A WHO study found that an estimated 4.5 million premature deaths could be prevented in low and middle income countries by 2030 through vaccination, diagnostic tests, medicines, and education campaigns. There are 5 main types of hepatitis: hepatitis A, B, C, D, and E. Let's quickly break down each type. Hepatitis A is typically spread through ingestion of contaminated water or food. It can also be transmitted through close contact with an infected person. Symptoms include fatigue, nausea, abdominal pain, loss of appetite, low-grade fever, and jaundice, that is yellow discoloration of skin and eye. Good hygiene practices such as hand washing thoroughly and vaccination can prevent hepatitis A. Hepatitis B is spread through contact with infectious body fluids such as blood, semen, and vaginal fluid. It can be transmitted through sexual contact, sharing needles, and from mother to baby during childbirth. Acute symptoms include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and jaundice. Chronic infection can lead to liver cirrhosis and liver cancer. Vaccination is the most effective way to prevent hepatitis B. Safe sex practices and avoiding sharing needles also reduce the risk. Hepatitis C is primarily spread through blood-to-blood contact, often by sharing needles or other equipment to inject drugs. It can also be transmitted through unregulated tattooing or piercing. Many people with hepatitis C have no symptoms until liver damage becomes apparent. Symptoms can include fatigue, fever, nausea, muscle and joint pains, and jaundice. There is no vaccine for hepatitis C, but avoiding high-risk behavior such as sharing needles can prevent infection. Screening and early treatment are crucial. Hepatitis D only occurs in people who are already infected with hepatitis B. It is transmitted through contact with infected blood. Symptoms are similar to those of hepatitis B but can be more severe. Preventing hepatitis B through vaccination also prevents hepatitis D. Hepatitis E is typically spread through ingesting food that is contaminated with fecal matter, for instance, contaminated water. A study in the American Journal of Obstetrics and Gynecology explores the severe impact of hepatitis E on pregnant women and emphasizes the need for improved prenatal care and screening. Symptoms include fatigue, nausea, loss of appetite, jaundice, and abdominal pain. In severe cases, it can lead to acute liver failure. Diagnosing hepatitis involves a combination of medical history, physical examination, and specific tests such as blood tests to detect the presence of hepatitis virus and antibodies produced in response to them. Liver function tests to assess the extent of liver damage. Ultrasound to visualize the liver and check for abnormalities. Liver biopsy. This involves surgical removal of liver tissue for examination under microscope. Treatment of hepatitis depends on the type and severity of infection. Hepatitis A typically resolves on its own within few months. Rest, hydration, and avoiding alcohol can help manage symptoms. Acute hepatitis B often doesn't require treatment and resolve on its own. Chronic hepatitis B may require antiviral medication to reduce liver inflammation and prevent damage. Chronic hepatitis C can be treated with antiviral medication that often cure the infection. Research published in the Lancet discusses the development of new antiviral drugs that have significantly improved the cure rates of hepatitis C. Regular monitoring and liver function tests are essential. Hepatitis D treatment focuses on managing hepatitis B co-infection. Antiviral medication and liver transplantation can be considered in severe cases. Hepatitis E typically resolves on its own. Rest, hydration, and avoiding alcohol can help manage symptoms. Pregnant women with hepatitis E virus require special attention due to risk of severe complications. Preventing hepatitis involves a combination of vaccination, lifestyle choices, and hygiene practices. Vaccines are available for hepatitis A and B. A study published in the journal Hepatology highlights the long-term efficacy of hepatitis B vaccine in preventing infection and liver disease. Safe practices. Avoid sharing needles, practice safe sex, and ensure blood products are screened. Hygiene. Wash hands thoroughly, especially before eating and after using restroom. Safe food and water. Ensure food is cooked properly and drink safe, clean water. That's all for today's video. Thank you for watching this comprehensive guide on hepatitis. Understanding the types, symptoms, treatment, and preventive measures can help you stay informed and protect yourself and others from this serious disease. If you found this video helpful, please like, share, and subscribe to Medical Minds for more in-depth medical content. Stay healthy and see you next time.